Welcome to Hope Talks podcast with Grayson Willis and Pastor Margaret Michael, where you'll hear inspiring stories that are filled with hope and good news in Jesus Christ. You can also search for our podcast on iTunes, Spotify, Google Podcasts, and TuneIn. We would love your feedback and invite you to take a short, anonymous survey. You can find the link to the survey in the show notes.
Welcome to today's broadcast of Hope Talks. I'm Grayson Willis.
And I'm Pastor Margaret Michael.
Thanks for tuning in today. And today we're joined by Susan Adamson and Lynne Eggert from the Blue Ridge Free Clinic. It's nice to have you all. How are you all doing today?
Doing great. Thank you for having us.
Yeah, thanks for having us.
If you all would just like to introduce yourselves and maybe say what it is you do at Blue Ridge Free Clinic, and then tell us a little background and how you all ended up there.
So I am a family nurse practitioner, and I've been practicing as a nurse practitioner for 30-some years now. Started out in a private family practice out in California many years ago. But very quickly in my practice, I realized that there were a lot of people that would come in and we could make a diagnosis, but they couldn't afford their medications. So I was very motivated at that point to try to figure out a way to solve that problem, and fell into the free clinic movement about 25 years ago, and I've never left. So I serve as a family nurse practitioner at the Blue Ridge Free Clinic and see patients the 3 half days a week that we're open, and then work in administration as the executive director the rest of the time.
And I'm Lynne Eggert. I'm an adult nurse practitioner and a relatively new transplant to Harrisonburg 12 years ago. I guess that's not too new. Also have spent most of my career in providing health care for underserved populations. Along the way, I did also pick up a master's of public health because I just saw public health issues being such a profound focus area for people that are not plugged into reliable health care systems. Have worked in a variety of settings, a lot of urban health care in both Baltimore and Washington, D.C., had some time overseas working in different realms there, and then landed in Harrisonburg and quickly found myself at the free clinic that was there at the time. With the Blue Ridge Free Clinic, my role is primarily with program management and development. So Susan and I are two sides of the same coin in a way.
Yeah, that's very good. So if I could, would you all want to share, where did the passion come from?
That's a pretty easy question.
Okay.
I mean, I think I live under the belief that we should love our neighbors as ourselves, and we know where that came from.
Yeah.
Right? We love because we were first loved.
Right.
And so part of that is it's an action verb. Love isn't just a feeling, but for me, it's figuring out a way to actually help someone with their life or their health, their comfort, their growth. And so that's, I think, my underlying passion for this is how can I love my neighbor as myself, and seeing now that my neighbor can be from anywhere in the world.
That's right.
Yeah.
Right.
And so that's been an eye-opener for me since I got to Harrisonburg, is I get to love neighbors from all around the world.
That's right. That's right.
I think for me, in my early nursing career, I did both orthopedics, so people that were victims of acute trauma, and then oncology nursing, and so people that clearly had really devastating illnesses that were shattering their families and their whole sense of faith in God a lot of times. And as a Christian, I just felt like I wanted people to be able to tap into the stable and rock firm love of Jesus, and how could I manifest that? And then as I saw people, again, living primarily in urban settings, I just saw so many people that were so far on the margins, and you could see by their behaviors that they didn't really value themselves, and our system didn't seem to value them either. So I wanted to be part of that solution and just say, how can I provide high-quality health care and honoring health care, and a vision to look at all aspects of a person to honor them in the way that Jesus would.
I think about the people, the oppression that we know is so evident in our world and was evident in Jesus' day too, and you see his compassion towards that. And it was right before the pandemic. There was a gentleman, he's actually a pastor in Roanoke, and he asked a question one day. We were in a meeting, and he said, who are the oppressed in your community? You know, what is that demographic in your community that are oppressed? And that will help you to know who you are to love, you know, what neighbors you are to love. And so it's just to hear you all talk about that, how God's passion in you, the love of Christ through you, has drawn you where you have a trade, you have a profession of helping people with the tents we live in, right?
It really is a privilege. I mean, I think We both love medicine and nursing and went to school a lot of years to learn our profession.
Yes, right.
Because we're interested in that, number one. But I think when you tie that in to getting to be intimately involved in people's lives, it is truly a privilege. It really feels, almost a sacred feel to it that deal with people who are vulnerable.
Right.
And we really want to protect and lift up, and having a place to do that. So the Blue Ridge Free Clinic has provided us a place where we don't have to worry about insurance companies. We don't have to worry about billing offices. It's the pure practice of medicine in a loving environment provided by people. We're not the only ones. There are many. There are more than 100 volunteers who are doing this because they love their neighbor, because they care for their community, because they're interested in the public health, which if a lot of these issues that we're taking care of are not addressed, there's going to be a bigger fallout. And so it just is amazing to me, a girl from southwestern Virginia that grew up on a little farm, to be now at this point of my life getting to experience, even though it's vicariously, but experiencing the cultures of so many places. Yes. And learning about people. And there's just such a richness in that kind of medical practice. And, I think that every day that I get to go into the clinic and then I leave, I have never left once not feeling like that was great. That was so worth it. And, I feel a paycheck could never do that. This is something that I feel so blessed by being there. And I get to work with people like Lynne Eggert, who runs all of our programs.
Well, right back at you. But I was going to add also is that Susan and I thought that as we were sort of envisioning with other community members and colleagues about the model for the Blue Ridge Free Clinic, we had thought we also want to provide a place where the love and gifts of this community can be manifest. And that has played out just so abundantly and is just an added gift to both Susan and I. We often wind up in tears while we're in clinic because someone will walk through the door with something that they want to donate to the clinic or some way that they want to give. Last night we had this delicious meal that was provided for us by two families so that it can nourish the bodies of our volunteers that come in the evening. The volunteers come in, they're all coming in, donating their time and their skills. They love it. And it's so rewarding to see that the Free Clinic has also offered a fulcrum through which people can share their gifts and their ability to love other people. So it's this full circle thing that's been really beautiful to be a part of.
As y'all were talking, I was thinking about something recently in a sermon series we had here talking about talents and abilities. And Pastor Margaret and I actually did a Hope Talks program talking about, using your spiritual gifts and the things God gave you. You talked about it being a privilege to be able to help and serve. And both of you have talked about that. And that's what I thought about it, is how you all are using your spiritual gifts and passions that the Lord has given you to help others.
Well, Lynne is very good at being able to manage programs and pursue programs. And she has developed things that are, I would say, ancillary or supportive of the regular healthcare visits that we have. For example, she has started a pharmacy program for us because what's the good of diagnosing diabetes if you can't give somebody the medicine for the diabetes or the food to eat properly? So that's the sort of thing that, the vision that she has is how do we go further and deeper and make this better and more comprehensive in the type of care. And so dental, we have so many patients that have dental needs. And she has gotten relationships with dentists who are volunteering in their offices for us. And they've helped probably upwards of 100 or more patients with abscessed or broken teeth and pulled them for free. So that's the kind of thing we get to dream together and then working together to figure out a pathway to make it happen. So,
And when God gives you that vision of, we could, you say dream, I say vision, God gives you this, we could do this, and then to see the doors open for those services to happen, that's amazing.
Well, sometimes Susan and I will look back because, we first met each other, 12 years ago when I first came to town. And never in a million years would we imagine that we were sort of providing co-leadership to this free clinic. But now looking back, we can see how God had orchestrated all of our steps and relationships with some of our community partners that we are just sort of slack-jawed at their generosity and the way that they go above and beyond. Susan mentioned the dentists and, just other community partners that we could see how, again, God has been working over time. And again, it's just a reminder that God's timing is perfect. And Yeah, we're just grateful.
And we sort of, so many times the needs that we've had that come up, we'll just talk about them. We'll just mention them. We'll say, oh, we really need this for this patient, or we're behind on this. We need to get some more of this. And we don't have a pathway. We don't know where it's going to come from or how we're going to. And it's almost invariably within the week or so, the door will open and what we needed is provided. Like it's uncanny how that has happened. So we know we're going to claim those as little miracles.
Amen.
We are going to claim them. And even funding has come. We started with no dollars. This was a new startup, grassroots free clinic that opened in April of 2021. So we're not even 3 years old yet. Wow. Now, granted, many of us volunteers had been at another free clinic for many years that closed. And there was another closure of a free clinic in Augusta. So we knew that there was going to be a need for a free clinic. I mean, our role is to catch people with unmet healthcare needs, whatever that means. No barriers. If you've got an unmet need, we try to find out if we can help. But we estimated that there might be, this was three years ago, we estimated there might be 250 to 400 people that would need us. Well, since we opened 2.5 years ago, we've seen almost 2,100 patients and over 7,000 office visits. And our building is pretty small. We only have a 2,400 square foot building. If we had known that, I think we would have been very afraid. It would have seemed way too big for us. But yeah, we couldn't have expected that we would be doing this. We couldn't do it without the Lord. There's no question, because it's not by my strength and ability or knowledge or anything. But He's provided the support, the staffing, the friendships, the community connections, the funding. It's coming in. That was one of our goals. We really wanted this to be something that the community came around. We're not a for-profit clinic. We don't make any money. The more we do, the more it costs.
Right.
And we always say we're going to do the best we can with what we have. Right. And so far, we're trying to stay up with the need. The need is great. So we're trying to work smarter, not harder. We're looking at ways to get to more people, to more patients, to get them in more quickly. The second part of our name, we're the Blue Ridge Free Clinic, but our tagline is Your Bridge to Health. So when we open this clinic, it's a different model than any other free clinic that I knew. We don't want to build a practice where patients come and stay with us. Our idea is that patients will come in, and in 3 to 12 months, we help them get whatever services they're entitled to, if that's possible. We were looking for a long-term, affordable, sustainable, accessible, long-term primary care in our community. So we work with the Community Health Center, we work with Centera Hospital, who provides a lot of our labs and imaging and other support with other family practices. And our goal is to get people through the free clinic across the bridge into long-term primary care. Because if we don't have patients cross the bridge into the community, it won't be long before our building is just too full to have any others. We want to stay open and available. Our goal is to see anybody who has a need within 2 weeks or less. And sometimes we do a lot better than that. We get to see them that day or the next day. But we want to be there for the people that are falling through the cracks, that have pressing healthcare needs that just are not yet met. And there are a lot of people like that.
Right. And the benefit also of staying small is that, number one, we can sort of check with each other and we'll often say to each other, hold this loosely. This is a gift for this moment. And our role we see as being, again, being small, being responsive to the various community needs at the time. And then again, trying to deepen relationships with other community members so that we can help be part of the solution for meeting that need. Doesn't have to be us. I think I can speak for Susan too, is that we have no pride of place. We're it's a gift to be here. It's a gift to be at the Blue Ridge Free Clinic at this moment in time. But aren't we fortunate to be part of a community where there's so many generous people and so many really well-staffed and top-notch nonprofits that are doing great work. So we want to be able to leverage relationships with them, again, to get people into those long-term sustainable.
Right.
It just reminds me of you're giving a hand up, right?
Yeah,
like you're helping them to navigate that healthcare system where it can be really overwhelming if you don't have health care, if you don't have some type of insurance, and you're trying to navigate all of that and figure out where to go. And that can be hard on any day for anyone.
And it seems like it feels like it can be very honoring to people to say, we're going to walk with you as you gain these skills of navigating this healthcare system. And you know what? Along the way, maybe we're going to find a way to get you some dentures. Or we're going to try to find a way to get you a prosthetic leg so you can work.
Just get your car fixed. or something, little things like that we call the social determinants of health.
Right.
Yes.
Housing, clothing, food,
Right.
transportation, language barriers. There are so many other things that impact healthcare, and that's where we've been really, really fortunate to have a bilingual social worker who's working with us. Thanks to Centera, they provided a grant, so we were able to contract a social worker because we're not social workers, but she really navigates people to all the resources that manage those other facets of your healthcare or of healthcare, and helping them cross the bridge into a long-term sustainable situation if possible.
Yeah.
But the needs keep changing. That's the other thing that, we talked about healthcare. People may have a job 1 month and then they've lost the job. There's something called the ALICE population, which is asset limited, income constrained, but employed. That's a fancy word for working poor. Yes. People that live paycheck to paycheck. And as long as everything's going okay, they can cover their basic needs of housing, transportation, childcare, food. But if one thing goes wrong, a flu, COVID, a broken leg, and then suddenly the job's gone, and then everything like dominoes falls apart. And so we have a lot of patients that move into service because they've had a bad thing happen, and we just want to support them until they can get back on their feet.
And it's great to see nonprofits partnering with each other to meet other needs, because people often have many needs, not just one need or another. So it's great that you all are helping connect them to other needs that they have as well. And before we started this broadcast, you all were talking about a fundraiser that you all have coming up. And so if you'd like to share a little bit about that.
Yes, we only have one fundraiser per year. And we have some volunteers that have put on, this will be the third one, a night of musical medicine. That's what they've dubbed it. And every year it's a concert. This year it's going to be on March 16th. And it's going to be in the Loft at Liberty, which is in the Mercantile across from Magpie Restaurant. It's being sponsored by Magpie. Is going to provide the food. We have Scott Miller, who is a folk rock guitar player from the Stanton area, but he's traveled with Robin and Linda Williams around the country. He has a lot of music on Spotify. And then a lot of the local other restaurants, and there are a lot of business sponsors who are helping to set the event up for us. But we can have up to 250 people, and it's a brand new music venue. So our greatest challenge right now is to get the word out, because a lot of people haven't heard about the Loft at Liberty. And it's a gorgeous, restored warehouse with big, beautiful wooden beams, an acoustic setting that's fantastic. And there'll be a silent auction. And, like I said, food, and there'll be a wonderful concert from 7 to 11 p.m. And people who want to come, it's $100 per ticket, and all of the proceeds, all of them, come back to the free clinic. Wow. So we're hoping we can sell 250 tickets, because that would help us tremendously. But if people are interested, they can go to the BlueRidgeFreeClinic.org website or our Facebook page, Blue Ridge Free Clinic. And there's QR codes to scan, or if anybody has questions, you can contact us through that. But we're very excited, and I think this is going to be a super fun event, and it'll be right as we're ready for spring, to kick off spring, and get out and do something, because by then we're really tired of winter. So we're looking to do an event at the start of spring. So
yes, that's great.
Thank you for sharing that. What else would you all like to share about the Blue Ridge Free Clinic?
Lynne has just done a phenomenal job, and so let's talk about what happened yesterday.
Well, we're continuing to try to find ways to help people access the medications that they need. So since we opened, we have been partnering with a program called the Access to Medication Program, which is based out of Richmond. And through this program, we can get medications filled in a central fill pharmacy through a free clinic in Fredericksburg. And that works pretty well. But as we're starting patients on new medications and getting them stabilized on a certain regimen of their medications, it's a little cumbersome, and it's also provides a financial barrier to keep sending prescriptions over to the local pharmacies for people to purchase. We've found a way that we can purchase some medications, individual 1-month supply bottles, labeled and packaged from a warehouse. and we can then distribute them on site. So Susan and I have gone through the process with the Board of Pharmacy to get ourselves licensed as limited use dispensers of
Something
medication.
else we never thought we'd do.
And then we've gone through the somewhat onerous process of getting our building and our procedures cleared and
Inspected.
Inspected. That's right. So that was quite a process. We were both exhausted at the end of it, but it looks like it's a big thumbs up, and we're super excited because that will allow us the freedom to see a patient. Let's say, for instance, they have to start on some diabetes medicine or maybe some hypertensive medicine. We can talk them through that and then hand them the pill bottle right there with the instructions. And then they come back 2 or 3 weeks later if their meds have to be changed a little. No loss. We can do that right on site.
Yes.
So it really reduces the barriers that prevent people from getting and maintaining adequate pharmacological treatment of their chronic diseases. So we feel really, really fortunate that that's been happening. The other thing I just have to shout out is that some of the bigger pharmaceutical companies have been extraordinarily generous with the very high-ticket item medications. I just wrote for coverage of a $13,000 medication for someone. And so anyways, that's been life-changing for a number of our patients because by the time you get to the high-ticket item medications, you're kind of sick. So we're grateful for the large pharmaceutical companies that have been good partners with us as well.
Lynne does all that paperwork. There's a lot of paperwork involved in applying for that and staying up with the medications, and I'm just so grateful that she's done that because these are medicines that people would just go without, and it would truly impact their life so negatively not to have. What we found through this bulk purchasing, when we found that we needed to get our pharmacist license, mini pharmacist license. We're not true pharmacists, we're prescriber pharmacists.
There you go.
We didn't even know that was a thing until about a month ago. So, but the medicines when we buy in bulk are so inexpensive. So by doing that, it's going to save, it'll save a lot of money. But again, the process of getting a patient, many of whom may not speak English, they may never have had a prescription before. We're dealing with a lot of new immigrants who are coming. Church World Service settles a lot of people here. There's a lot of immigration happening in our area. And many people who've never been sick or they've never used a pharmacy before, they don't even know how to fill a prescription. Or if they go to the pharmacy to pick it up, their names are very complicated and there might be misspellings or they don't know how to say their birth date in English. And so we found that we were sending prescriptions to local pharmacies, and a lot of times the patients didn't make it to the right place. They didn't know how to pick it up. It might be only $4, but only $4 to somebody that has no dollars is more
a lot
than
of
they can
dollars.
pay. So, we're very excited about this. It's a lot of work. We're trying to, like I said, work smarter, not harder. But we're excited about this program, and we're going to be asking the community for some more support because we're going to have some pharmacy techs perhaps coming in to fill the prescriptions. Lynne and I just love seeing the patients. So we can't go back and fill every prescription. So,
That's right.
So this program is going to be opening up probably in the next 2 weeks.
Wow. So within a 6-week period, you find out, hey, we could be some
pseudo-pharmacist.
And now 2 weeks to go, and it's done.
Yeah.
Which is just to your point earlier that God opens doors and then he works out the details.
And we just need to walk through.
Yeah,
I mean,
that's
that's the
right.
thing is to have, sometimes I think Susan and I look at each other and say, are we brave enough to walk through this door? Another door, God. But it's a privilege. The other thing I wanted to also give a shout out to the Blue Ridge Area Food Bank, who has been a phenomenal partner of ours. And I know you all have, food bank resources as well. And it just is so gratifying to see just a whole rack full of healthy foods. There's healthy beans and oils and cereals and soups, and people will come in not even for an appointment, but they know it's there, and they'll come in and just get a bag or two of groceries just to tide them over. And we have had some partnership with some local dietetics programs that will also provide recipes. We've even had cooking demonstrations in our lobby to sort of round out the whole picture of nourishing people's bodies as well as their spirits.
Would you all have a story that you would like to share just anonymously of someone that came in that, I know every visit's life-changing, but just a situation where their life was changed, transformed by the experience of Blue Ridge Free Clinic?
Oh, I think one of the diseases that we fight a lot is cardiovascular disease. And so for people who haven't had health insurance or health care, we often see the result of that. So instead of treating just the high blood pressure, we see them after they've had their heart attack or they've had their stroke. And so that's one of the saddest things to me when I see somebody that hasn't been able to care for themselves. And so I'll say that's sort of not a common thing, but it's a frequent thing. We'll see someone who's already had a mini stroke, and they think they can't go anywhere, and somebody at the hospital might say, hey, go to the Blue Ridge Free Clinic. They go to the emergency room, their blood pressure's through the roof, and they're given a prescription, which they can't fill. But now the word is getting out that you can come to our office and you'll be well received. We don't turn anybody away. We try to help everybody as much as we can. And so the word is out, and we've had at least 1 or 2 patients come in the past couple of months who've had many strokes. And one most recently came in and had health care for 20 years. 20 years. And she knew she had high blood pressure, and she worried about it, but she couldn't afford the blood work, she couldn't afford the medication, she couldn't afford the office visits. And so when she came in, we were able to get her on medication. We paid for her first medicine to get her blood pressure down as part of the process. So she was having some chest pain, so we sent her back over to the hospital, and we found out that she had an aneurysm. And with that aneurysm, without treating her blood pressure, it was very likely that aneurysm would explode or rupture, and that would be sudden death. So we've been able to get her blood pressure down. Well, as part of our visit, she also met with our social worker who did a needs assessment and was able to help her with her transportation. She could not afford gas to get to her office a couple of times, so we have an Uber account. We Ubered her. She got her car. Eventually, she was able to get her car fixed. And then our social worker did an application for her. She did not realize that she was eligible for Medicaid. She had no idea. And so the social worker helped her fill that out. She still works part-time, even though she had a mini stroke. She's able to work part-time, but she's eligible for Medicaid. And she has finally the peace. She doesn't have to worry about accessing health care from this point forward. And that aneurysm can be monitored every year. So she feels like her life is finally stable, and it was all related to not having access to health care that now she does.
The bridge.
The bridge,
right?
that's right.
Yes,
that's right.
That's amazing. Thank you for sharing that. And that brings quality of life. It brings hope for her, because I can't imagine not having, those resources. It's a little hard maybe for us to understand sometimes. And I hope today, as people are listening, that they feel led to in some way be involved in this, whether it's by giving, by attending the event.
Yes.
I would like to come.
Oh, great.
And maybe there are people that are listening that need health care. Maybe they know someone, a neighbor, a family member that could use these services. So I'm really glad to have you all here today. And I did want one thing I wanted to say before we wrap things up is you came here this past August and set up here in our lobby, and in our classrooms became exam rooms.
That's right.
And provided services to many people, back to school physicals and sports physicals for the kids getting ready to go back to school, and was a part of a community serve day that we did here. And I think that was a beautiful partnership.
Oh my goodness. It was such a nice fit, because, being able to go out into the community is always, it's rewarding, because a lot of people don't know where to go, but with your church, you're able to provide the publicity for the event. People knew where to come. And then the church provided us beautiful spaces. These Sunday school classrooms became wonderful exam rooms, and there were interpreters provided for us. And so we had all the liability coverage of being the Blue Ridge Free Clinic working off-site.
That's right.
So we had volunteer doctors from your own congregation, jumped right in, and they became immediately Blue Ridge Free Clinic doctor volunteers. And we knew that there were a ton of kids that needed their physicals so they could start school the first day. And you all identified that. We identified it, but didn't have the place and the space and the time. So it was a wonderful way to partner together. And we saw 64 kids that day.
Yeah.
64 kids got to go to school because we were able to join together for this. It was a wonderful day.
And, I think we're better together when we come outside the walls of whatever organization we're in and partner with the community to provide services and to make those connections. Working together, we can provide so much more.
Well, we really appreciate you having us on this podcast today, just to let people know, because if there are people that need us, we want them to find us.
Yes.
Just let the community know. We're just so grateful to the community for being for supporting us, and like you all joining with us, and we'd love to partner with you in the future if things come up.
Yes, we want to continue that partnership. And in a week or so, we'll have the doctors that did that clinic will be on the podcast, and so you'll be able to hear their stories about being involved. And so we're excited about that.
Well, and since then, we have had at least one of those doctors come and now is volunteering at the free clinic with us.
I was hoping.
A win-win.
I was hoping.
Yes.
I know that one of them, that was something that they had wanted to do for a long time and just hadn't been able to do it. So that was the jump start.
Good connection.
Yeah.
You shared it earlier, but just in closing, if you would share your website again, and also the phone number for the free clinic in case somebody doesn't have internet and they're listening.
Okay. The website is www.blueridgefreeclinic.org, and the phone number is 540-705-0337.
Thank you, Lynn, and thank you, Susan, for joining us today. It's been great to have both of you.
Thank you.
Yes, thank you all very much.
Thank you for listening to today's broadcast of Hope Talks. I pray that as you've heard us talk with Susan and Lynn today about the Blue Ridge Free Clinic, that today's broadcast truly has been a half hour of hope for your life. May God bless.
Hope Talks is sponsored by Church of the Nazarene Harrisonburg in partnership with Sunshine Ministries.
Thanks for listening to today's podcast of Hope Talks. If you enjoyed the podcast, please subscribe for updates and the latest episodes. Also, if you're in the Harrisonburg-Rockingham County area, we invite you to listen on the radio each Sunday at noon on 1470 AM or 102.1 FM WBTX.